Hello, my name is Ashley McFarland, and this is my head-to-toe physical assessment video. Before we begin, I just want to say that I'm using a master cardiology stethoscope, so there's not a separate diaphragm and bell. So for different tones and sounds, I will be pressing harder or softer on the end of the stethoscope. Before entering the room, we checked a full set of vital signs on the patient. We measured his height and weight and assessed his BMI. We also checked his distance vision with his Snellen chart, and we had him empty his bladder. He then put on a gown, and for this video, he'll be wearing shorts and a tank top. Prior to assessing the patient, I would have washed my hands. Okay, so as we walk through the room, first we're just going to take a general look at the patient, just see how he's doing overall. It looks like he's breathing well, no acute distress, good body alignment, good muscle tone. He seems to be in good spirits, so we'll go from there. First, we're going to look at the head, moving from top to bottom, and the face. Looking on the back of the head and the skull, the side, no obvious bulges or deformities. No areas of redness or dryness. Looking at the face, the eyes, the ears, everything looks symmetrical, both eyebrows, all the facial features look good. We're going to go right into palpating the skull, checking for any areas of tenderness, any pain. Does everything feel okay?
Yes.
Any bulges or deformities. We're also looking at the hair. The hair should be soft and silky, not brittle or coarse. No unusual areas of baldness or hair loss. Okay. From there, we're going to go into inspecting the facial bones. Make sure everything's aligned, making sure there's no tenderness or pain. And we're going to palpate the sinuses, checking for tenderness there. Does everything feel okay?
Yes.
Okay. Then we're going to move into the temporomandibular joint. Okay, can you open and close? Open, close. Okay, we didn't have any clicking or popping, so that was a good assessment. From there, we're going to go ahead and just check the lymph nodes. I'm going to check the preauricular lymph nodes. They should be soft and movable. The postauricular, the occipital region, the segmental, the submandibular, our tonsillar, our anterior cervical chain, our posterior cervical chain. I'm checking our deepness, and then our supraclavicular. Okay, and everything looks good there. We're going to check sensation on the face. I'm going to touch you with two objects. Tell me if it's soft or dull, okay? I mean sharp or dull.
Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull.
Okay, good. Okay, and I'm going to check some of your cranial nerves. Can you close your mouth tight? Close your eyes. Wrinkle your forehead. Smile. Blow out your cheeks. And stick out your tongue. Can you also stick your tongue from side to side? Okay, looks good. So now we're going to move on to our assessment of the eyes. We're going to look at the eyes, the eyelashes, and the eyebrows. Make sure we don't see any drainage, any redness, that there's no crusting on the eyelashes, that the pattern of hair is equal on the eyebrows. We see a scar here, but other than that, everything looks normal. We're going to go into palpating the eyelids, palpating for any tenderness, palpating the lacrimal apparatus. Okay, and actually before that, we would have also, when we were looking, we had looked at the sclera and the conjunctiva. So we would have looked in for any redness, any drainage, any swelling, and everything looks good there. We're going to move into our exam of the eyes. If you could look straight at me, we're checking to make sure the pupils are equal and reactive to light. Look straight at me. Good. Look straight ahead. Okay. And good light reflex. If the room was too light, we could turn the lights down and check. That would also help us, okay? We're also going to check for extraocular eye movements. If you could follow my pen, please. Okay. All right, good. Okay, and I want you to look straight at me, cover one eye. Tell me when you can see my hands.
No. No. No.
Okay, and cover the other eye.
No. No. No.
Okay, good. Alright, so moving on to the ears. First, we're going to do a general inspection of the ears. The ears are symmetrical on both sides of the head. Looking at front and back, making sure we don't see any bumps, any real redness, any dryness, any lesions in the inner ear or outer ear. We're going to palpate the auricle and the pinna of the ear. No bumps, lesions. And then if we had an otoscope, we would look in the ear, but we'd be looking for any redness, dryness, any over buildup of wax, any drainage. We'd also assess the tympanic membrane. It should be a gray pearly color. Okay, we're going to do a couple hearing tests. I want you to go like this with your hands in front of one ear. I'm going to whisper a word over here. I want you to say what it is, okay?
Banana.
Okay, and we're going to do the other ear.
Apple.
Okay, good. All right, next we would use a tuning fork. To do the Weber test, we would hit the tuning fork, place it on the center of the patient's head, and they should tell us whether they hear the vibration in both ears equally or one ear over the other.
Equal.
Okay, so that would be an accurate assessment. We would then do the Ryan test. We would hit the tuning fork again, place it behind the patient's ear on the mastering process, and we would ask the patient to tell us when the vibration stopped.
No.
Okay, and once they stop, we would move the tuning fork in front of the patient's ear and assess again for when the vibration stopped.
No.
Okay, and that would be an accurate assessment. Our conduction should be twice as long as bone conduction. After that exam, we would do the same exam on the opposite ear to make sure they were equal. Moving now to the nose. First, we're going to assess the nose, the structure of the nose, the septum, whether it's aligned. This patient, before beginning our exam, told me he had once broken his nose, so it's a little different there. We're going to go into looking at the inside of the nose, checking for any redness, polyps, checking the turbinates, checking for any drainage. Okay. We want to check patency of the nostrils, so can you put your finger over one nose and blow it out? Okay, and the other one? Okay, very good. So from there, we're going to move on to the mouth and the lips. First, we're just going to look at the lips. They look very pink and moist. There's no blueness, indicating problems with oxygenation or cyanosis. No extra dryness or cracking. No cracking in the corners of the mouth. We're going to look inside the mouth. If you could open your mouth, please. Looking at the anterior and posterior walls, looking at the posterior pharynx. We look at the floor and the top of the mouth. We're going to look at the anterior posterior pillars in the back and the uvula. Looking at the tonsils, they shouldn't be swollen or red. Everything looks pink and moist. I don't see any lesions, any bumps. Looking at the tongue, it should be nice and pink. Good. We're going to look at the teeth while we're here. Good dentation, very white. We don't see any chipped or broken teeth. Any areas that look like they're infected. We'd also assess the odor while we're here. Sorry. But everything looks good. Can you say ah? Okay, check it for movement of the uvula. We'd also check the gag reflex. Okay. Good. All right, and that's good. Okay, moving on down, we're going to assess the neck. First, we're going to look at the neck. Everything looks good. Round, soft. I don't see any areas that are protruding or bumps. Can you look this way? We're going to check for jugular vein distension. I don't see anything. Okay. We're going to check for flexion and strength of the neck. Can you turn to your left, right? Can you turn your head and look over both shoulders? Okay. And can you push against my hand? Okay. And equal strength in the neck. So next we're going to palpate the neck. Checking for any bumps or bulges, any areas of tenderness or pain. Does everything feel okay?
Yes.
Okay. We're going to palpate the carotid pulse. Okay, good. We're going to palpate the trachea. Make sure it's midline with no deviations. Good. Can you turn this way just a little bit? And then we're going to assess for the thyroid. Okay, can you swallow for me? Okay, great. Sit straight back. We're going to listen to the carotids and also the thyroid. We're checking for any We don't want to hear any thrills, any pulsations, any heaves. And listen to your thumb. Okay, and everything looks good. Sometimes you might have the patient hold their breath for a second so that you can listen a little better. Excuse me. Moving on now to the hands, the arms, and the shoulders. First, we're going to do a general inspection, looking at the hands, arms, making sure we don't see any unusual patterns of hair distribution, making sure the arms and the hands look symmetrical on each side of the body, and they do. Looking for any bumps, lesions, or rashes. Okay, now we're going to look at the hands here. I'm going to check for strength. Can you pull on my hands? Okay, and out. Okay, can you bend your wrist and your arms here? And let me see you move your arms around, just checking for range of motion. We have good range of motion. Okay, we're going to look here at the hands and the nails. Capillary refills less than 3 seconds. I don't see any clubbing or bluing of the nails, which would indicate problems with oxygenation. The nails are good and strong, no chipping, breaking. The hands and the arms are both warm. Okay, we're going to check your radial pulses. They're equal and strong. Checking the brachial pulses. Very good. And then we would check underneath the arms for the axillary lymph nodes. Okay. Next, we're going to move to the posterior chest and lungs. First, we do a general inspection of the back. We're just going to look. It looks very equal. We're going to have you bend over just a little bit. The spinal column is curved appropriately. Good. Looking at the cervical, the thoracic, and the lumbar region, and everything looks nice. There, you can sit up straight. As the patient moves, lung movement looks symmetrical. I don't see any use of accessory muscles or any trouble breathing. Okay, from there we're going to palpate. I'm going to palpate down the spinal column. Tell me if you feel any tenderness or pain. Okay, that feels good. Just kind of doing a little palpation around the muscles, checking the muscles in the back. Okay. We're going to check for tactile firmness. Can you say 99?
99.
99.
99.
99.
99.
Okay. We're going to check for equal lung expansion. Can you take a deep breath in and out? Okay, and again. Okay, good. We're just going to do some quick percussion around the back and the lungs. Going from areas of resonance to dullness. Now we're going to try to measure the diaphragmatic excursion. I want you to take a breath in, push out, and hold it. Okay. And then I want you to take another breath, a big breath in. And we would measure the distance there. We do this also on the other side. The distance in between should be between 3 to 5 centimeters. We're also going to palpate the costovertebral angle. And we're going to press against both kidneys. See if there's any tenderness. Do you feel any tenderness there?
No.
Okay. Good. We're going to listen to for lung. Move from side to side. Can I take a deep breath? Move to the left, the right. Okay. Okay. Deep breath. And the outsides of the lungs. Okay. That looks good. Moving on to the anterior chest. Okay. First, we're going to look at the chest. Make sure that muscle tone is equal expansion of the chest with air movement. No overuse of the abdominal or accessory muscles. That looks good. I'm going to palpate the muscles of the chest. The anterior lungs. Everything looks good. apical pulse. Equal and strong. Next, we're going to listen to the anterior chest. Deep breath. Okay. We haven't heard any crackles, wheezing with the lung, any rails, any problems with breathing. Next, we're going to listen to the tones of the heart. As we're listening, we need to make sure we don't hear any thrills, any pulsations, or any heaves. We're going to start from the aortic valve, the pulmonic, we're going to go to the Erb's point, which is the point of maximal impact, your tricuspid, and the mitral. Okay. Everything looks good there. Next, we're going to move on to our abdominal assessment. If you could lay down for me, please. Okay. Normally, when we're assessing, we would assess directly against the skin, but for the privacy of the patient, we're not going to do that, especially with the abdominal assessment also. First, we would look at the abdomen, looking for muscle tone, looking for contour of the walls, looking for any bulging, any herniation. We didn't see anything strange. If you had any difficulty seeing, you could take a light and shine it to you. It could help to see if there's any bulging, and everything looks good there. Next, we're going to listen to the bowel sounds, starting from the right lower quadrant. Okay, the bowel sounds are all active. If they weren't, we could continue listening for 3 to 5 minutes. Next, we're going to listen to some of the arteries. While we're listening, we're also assessing for any pulsations, heaves. Into the aortic artery. The iliac artery, the renal arteries. The iliac arteries. And then we would assess also the femoral arteries. From here, we're just going to do some light percussion around the stomach. Checking for the tone of the organs. Okay. We're going to do some light palpation. Okay. You're going to measure the border of the liver. Okay, then we're going to go out. Okay, we have that right there. We're going to percuss the spleen. Sometimes you're being difficult with this, you can have the patient take a deep breath and hold them. That could help also. Okay, from there we're going to do some deep palpation. Checking for any pain or tenderness. Everything feel okay?
Yes.
Making sure that all the abdominal organs are soft and movable. Okay. We're going to palpate the liver. Liver border. Okay, good. We try to palpate the spleen, but we should be able to. Okay, don't feel anything. I'm going to try to palpate each kidney. Okay, and that looks good. Okay, all right, you're going to sit up. Next, we're going to move on to the legs. First, we're just going to look at the legs here, looking at the feet, the lower extremities, checking the toes to make sure we don't see any funguses or anything there. Looking at the hair pattern of the legs, it could indicate some kind of problems with arterial or venous flow. Next, we're going to look at the toes. We're looking again at the nails, making sure there's no cracks, cyanosis, any problems with that. We're going to feel the legs. They're soft, warm, good muscle tone. We're going to assess the pedal pulses. Your posterior tibial pulses. Okay, and the popliteal pulses. We're checking for edema, swelling in the legs and ankles, and everything feels good there. We're going to check for strength of the feet and legs. Can you pull against me? Okay, and push with your legs. Okay, let's push down with your feet. Okay, and up. Okay, good. We're going to check reflexes. We don't have a reflex hammer, but we're going to be using this. Also, the patient would generally have the feet and legs hanging off the bed for appropriate assessment. Okay. 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 You see your arms? Okay. That all looks good. I'm going to have you stand up real quick. Checking for the patient's posture and everything. If you could walk to that side of the room and back. Making sure they have a steady gait, equal alignment and symmetry of movement. Okay, can you do a squat for me? Checking for muscle tone, everything looks good. And turn around. Trying to have you just bend over here. Checking for alignment of the hips, the vertebrae, symmetry in the back. Okay, you can stand up and have a seat. Okay. I want to thank my patient here for volunteering for this. It's been a long haul, and that ends my assessment. Thanks.